It's been a roller coaster ride for the country's already weak health system, burdened by shortages and a massive HIV rollout program. The global health system is already overwhelmed, and there were doubts South Africa will be able to handle this pandemic. Frontline staff like nurses are most vulnerable. Over 500 healthcare workers have tested positive for COVID-19 with 2 deaths, and this has been a cause for concern.
The first thing is the healthcare provider infections, and that's been a big concern everywhere in the world. And we've seen about 10% of positive cases are healthcare workers. And that's been the same in South Africa as well, where about 10% of those numbers that you see are healthcare workers. And the problem is even someone who is mildly ill has to be away from work. And that's if those numbers keep increasing, that will be challenging. Again, the whole philosophy of to flatten the curve means that people can recover and come back to work. And that's not currently a problem. But if we do get a big surge, we will see an increased number of healthcare workers infected as well.
Health workers have made predictions on when to expect the worst, while there are plans for that moment. Right now, the country still needs protective gear for healthcare workers.
PPE is one of the big challenges, and that has been a challenge everywhere in the world, that there hasn't been a sufficient quantity of PPE, and that it's difficult to come by, and we need to use masks and so on for longer periods of time than we would like to. I don't think there's no evidence to say that it makes it less safe for us, but it does make things more difficult and more complex, and certainly a bit more frustrating. The use of PPE can be time-consuming. It makes it more difficult to treat patients, and sometimes means that we can't treat patients as quickly as we would like, and that's frustrating for patients, and it's frustrating for us as well.
A total of 369,697 tests have been conducted to date. And with the number continuously rising, the president of Emergency Medicine Society of South Africa believes the country has enough to battle the pandemic.
We have now gained knowledge from how they have treated patients in Europe and the United States. And I think our ability to treat patients without, for example, ventilators and so on is better now than it was before. So I think the hospitals will get busy. But I think there's a very good chance that we will have the facilities to cope with the surge of patients when we see them.
This year's International Nurses Day comes at the time when the globe is fighting an unknown brutal coronavirus. Whether government's interventions will be enough is a big question. Ntlanhla Khatlani, SABC News, Johannesburg.